Hi guys, let's learn about the most favorite bone of most of the medical students, the scapula or the shoulder bone. So the scapula forms the posterior part of the shoulder girdle. It is a flat triangular bone which consists of translucent fossas or surfaces. Fossas is another word for surfaces. Here we have the diagram of the scapula. This is the costal surface and this is the posterior surface or the dorsal surface. So here is a quick intro of the scapula. So this bone consists of two surfaces, the dorsal and the ventral surface. The dorsal surface is the posterior surface and the ventral surface is also known as the costal surface or the subscapular fossa. Fossa and surface are the same thing, and which is basically the anterior surface. The scapula consists of three borders: the medial border, which is thin, the lateral border, which is thick, and thirdly, the superior border, which is again thin. The medial border is also known as the vertebral border, and the lateral border is also known as the axillary border, which prevents the buckling of the shoulder blade. The scapula consists of three angles: superior, inferior, and the lateral angle, which is also known as the glenoid angle. And most importantly, it consists of three processes. Now, this is a very important feature. So, firstly, the spinous process, second, the acromion process, and thirdly, the coracoid process. And the shoulder bone extends between second and seventh rib. Let's talk about the side determination of scapula. So basically in side determination you have to tell whether the bone is present in the right side of your body or the left side. So we can use these 3 points here. Look for the glenoid cavity, that the glenoid cavity is always present on the lateral side of the bone. The costal surface is concave and the dorsal surface is convex, which is divided by a triangular spine. So here the posterior surface or the dorsal surface, this is the triangular spine which divides the posterior surface into two parts, into two surfaces or two fossas. We'll learn about that ahead. Now let's talk about the features separately. So as far as the surfaces are concerned, the scapula consists of two surfaces, the costal surface and the dorsal surface. The costal surface is concave and is directed medially forward. It consists of three longitudinal ridges, and the ridge that adjoins the lateral border is the thickest one, which is also rod-like in shape. So here in the diagram, this is the costal surface and it consists of three longitudinal ridges. So we have the first one here, this is the second one, and this is the third one, and the third one which adjoins the lateral border of the scapula is the thickest one. Now on the dorsal surface we have got the spine of scapula, which is connected to the surface by the spinoglenoid notch, and it divides the dorsal surface into, or the subscapular surface into, smaller supra and larger infraspinous fossa. So the supraspinous fossa is the smaller one and the infraspinous fossa is the larger one. Here this diagram shows the supraspinous fossa and this is the infraspinous fossa. and the entire posterior surface is divided into these two fossas by the spinous process. Let's talk about the borders now. So the scapula consists of three borders: the superior border, the lateral border, and the medial border. The superior border is thin and short, and it consists of the suprascapular notch, which is present at the root of the coracoid process. So here we have, this is the superior border, and it consists of the suprascapular notch, which is visible here. This is the suprascapular notch, and here is the coracoid process. This is the coracoid process, at the root of which we have got the suprascapular notch. It is more obvious on the costal surface. This is the coracoid process, and here at the root of the coracoid process we have the suprascapular notch. The lateral border is thick and consists of the infraglenoid tubercle at its upper end, and there is also the presence of spinoglenoid notch. And the so basically this notch is converted into a foramen because of the presence of the spinoglenoid ligament, and then the contents of the foramen are the suprascapular artery and nerve. We will learn all about that later ahead in this video only. Yeah, stay tuned. Let's talk about the medial border now. So it is a thin one and it extends from the superior angle to the inferior angle. We have the medial border, which extends between the superior and the inferior angle, and this is the lateral border. So here in this diagram, this is the lateral border and this is the medial border. Let's talk about the angles quickly. So the scapula consists of three angles: superior, inferior, and lateral, which is also known as the glenoid angle because of the presence of glenoid cavity at this angle. The superior angle is covered by the trapezius muscle, the inferior angle is covered by the latissimus dorsi muscle, and the lateral angle is a broad one and it bears the glenoid cavity. Quickly in the diagram, this is the superior angle, this is the lateral angle, and here we have the inferior angle, and at this point the lateral angle consists of the glenoid cavity. Again, superior angle, inferior angle, lateral angle, and here we also have the, and here in this diagram we can see this is the superior angle in the if we look from the costal aspect, this is the superior angle, inferior angle, the lateral angle, which consists of the glenoid cavity. So yeah, now it's more obvious here. One more important feature that you all should be able to locate. So as we discussed earlier, that on the lateral border we can see the supraglenoid tubercle and the infraglenoid tubercle. So the lateral aspect of the scapula gives you the glenoid cavity obviously and the tubercle. So tubercle is like an elevation only. So the tubercle that is present above the glenoid cavity is the supraglenoid tubercle, and the one that is present beneath the glenoid cavity is the infraglenoid tubercle. This is the infraglenoid tubercle and this is the supraglenoid tubercle, and these tubercles are very important because they give origin to some important muscles. We're going to learn about them ahead. So yeah, the lateral view also gives you the Coracoid process and the Acromion process and the spine very clearly. And we can also see the supraspinous fossa, and this is the infraspinous fossa, and this is basically the lateral view. So this border is the lateral border, obviously. And again, yeah, the inferior angle. So yeah, it's all very clear and obvious in all of the views of the bone. All the features are quite obvious. And one more important thing is the clavicle here. We learned about the clavicle in our last video, and we also learned about the coracoclavicular ligament. So here you can see the coracoclavicular ligament, which is present, which is attaching, which helps to attach the clavicle with the coracoid process of scapula. And here we have the acromioclavicular ligament. This is the acromioclavicular ligament, which provides the ligamentous supply to the acromioclavicular joint, which is the joint that exists between the clavicle and the acromion process of the scapula. So I hope all of it makes sense now. Okay, now let's learn about the processes of the scapula in detail. So first of all, and most importantly, we have the spinous process, which is a triangular plate consisting of three borders and two surfaces. So the bone scapula itself consists of three borders and surfaces, as well as the angles, but the spinous process separately also has its own borders and surfaces. So the scapula has its own borders and surfaces and the angles as well, but the spinous process has its own borders and surfaces separately. So talking about the spinous process only, it consists of three borders and two surfaces. The borders are anterior, posterior, and lateral, and the surfaces are the superior and inferior surface. This is the spinous process, which consists of three borders. So, this is the posterior border, this is the posterior border, this is the anterior border, and this is the lateral border. This entire thing is the spinous process. Again, this is the posterior border, this is the anterior border, and this is the lateral border of the spinous process. The scapula bone, this entire is the scapula, obviously. It has its own borders and surfaces also. The superior border of scapula, the medial border of scapula, and the lateral border of scapula. But talking about the spinous process separately, we have its anterior border, we have its posterior border, which is more obvious here in this diagram. From the posterior aspect, if we see, this is the posterior border which is facing posteriorly, and this is the anterior border, and this is the lateral one. And we can also see the deltoid tubercle here. So on the spine we have the deltoid tubercle, which is the exact point of attachment of the deltoid muscle. The spinous process divides the dorsal surface of the scapula into two surfaces or fossas, the supraspinous fossa and the infraspinous fossa. The supraspinous fossa is continuous with the superior surface of the spinous process, and the infraspinous fossa of the scapula is continuous with the inferior surface of the Spinous process. The posterior border of the spinous process consists of the crest of the spine. Here we have already seen the supraspinous fossa and the infraspinous fossa. Talking about the surfaces of the spine, so this is the inferior surface of the spine, which is continuous with the infraspinous fossa, and here we have the superior surface of the spine, which is continuous with the supraspinous fossa. The superior surface is not quite visible in this diagram. You can imagine that since this is the spine and this is the supraspinous fossa, so the surface that it is continuous with is the superior surface of the crest of the spine. I hope it makes sense. Remember we talked about the posterior border. So this is the posterior border of the spine and it consists of the crest of the spine. So this is the crest. Here we can see this is the crest of the spine. The crest of the spine consists of the upper lip and the lower lip. The upper lip is covered by the trapezius muscle and the lower lip is covered by the deltoid muscle. Here we can see that this is the crest of the spine and this line gives you the upper lip of the crest of the spine and this line here gives you the lower lip of the crest of the spine. The upper lip of the crest of the spine is continuous with the medial border of the acromion process and the lower lip of the crest of the spine is continuous with the lateral border of the acromion process. We will also see this in the next heading, but let's locate in the diagram first that this is the upper lip of the crest of the spine which is continuous with the medial border of the acromion process. This right here is the acromion process and basically the spinous process is continuous with the acromion process. And how exactly? So the upper lip of the crest of the spine is continuous with the medial border of the acromion process and the lower lip is continuous with the lateral border of the acromion process. It is also visible in this diagram which shows the costal surface of scapula that this line here, you can see this line is the upper lip of the crest of the spine which is continuous with the medial border of the acromion process and this is the lateral border of the acromion process which is continuous with the lower lip of the crest of the spine. And also we were trying to locate the superior surface of the crest of the spine, right? So I guess this surface here gives you an idea of the superior surface of the crest of the spine as well. I hope it all makes sense. We have already seen the acromion process in the diagram, so let's just quickly learn a few pointers about it. That the acromion process forms the subcutaneous point of the shoulder. So the pointy edge of the shoulder is actually the acromion process and it consists of two borders, the medial border and the lateral border. Again, we discussed all of this. The medial border is covered by the trapezius muscle, the lateral border of the acromion process is covered by the deltoid muscle. It consists of two surfaces as well, the superior and the inferior surface, and it has a facet for the clavicle to make the acromioclavicular joint. And we have also seen the coracoid process before in the diagram. It is directed forward and laterally and it has got attachment for three muscles. This is the coracoid process. It is directed forward and laterally and it gives attachment to three muscles. Alright guys, let's talk about the muscle attachments on scapula. First of all, we have the deltoid muscle. It consists of three origins. Firstly, the lateral one-third of clavicle. Secondly, the lower border of the crest of the spine of scapula. And thirdly, the lateral border of the acromion process. It inserts in the deltoid tuberosity of humerus. Then we have the supraspinatus muscle. Origin for this muscle is the supraspinous fossa of the scapula, and the insertion is in the greater tuberosity of humerus. Thirdly, we have the infraspinatus muscle. Its origin is in the infraspinous fossa of scapula, and it inserts in the greater tuberosity of humerus again. Fourthly, we have the teres major muscle. The origin is the lower third of the lateral border of scapula, and the insertion is the medial lip of the bicipital groove of the humerus. Fifth, we have the teres minor muscle. The origin is in the upper two-third of the lateral border of scapula, and it inserts in the greater tuberosity of the humerus again. Then we have the subscapularis muscle. The origin is in the subscapular fossa, and the insertion is in the lesser tuberosity of the humerus bone. Seventh, we have the serratus anterior muscle, which originates in the upper eight ribs and inserts in the medial border and inferior angle of the scapula. Then we have the pectoralis minor muscle, which originates in the third, fourth, and fifth rib, and it inserts in the medial border and the superior surface of the coracoid process. Then we have the levator scapulae muscle, which originates in the transverse process of first four cervical vertebrae, and it inserts in the medial border of scapula from the superior angle to the root of the spine. Then we have the rhomboids. So firstly, the rhomboid minor. The origins are seventh cervical vertebrae and first thoracic vertebrae, and it inserts in the medial border of the scapula opposite to the root of the spinous process. Then the rhomboid major. The rhomboid major originates in the second to fifth thoracic vertebrae, and it inserts in the medial border of scapula between the root of the spine and the inferior angle. Then we have the bicep brachii. The origin for the long head of bicep brachii is the supraglenoid tubercle, and for the short head is the lateral part of the tip of the coracoid process. The insertion is not quite important for this video. Then we have the coracobrachialis muscle that originates in the medial part of the tip of the coracoid process. Then we have the tricep, which originates in the infraglenoid tubercle, the long head. Tricep consists of three heads, and the long head, which is related to the scapula, originates in the infraglenoid tubercle. The other two are the short head and the lateral head, but they are not important for this video. So yeah, just remember that the long head of tricep originates in the infraglenoid tubercle. Then we have the latissimus dorsi muscle, which inserts in the inferior angle of scapula. Then we have the omohyoid muscle, it's inferior belly specially, which attaches to the superior border of scapula near the suprascapular notch. Yeah, bicep brachii again. The short head originates in the coracoid process, lateral part of its tip, and the long head originates in the supraglenoid tubercle. And we have the trapezius muscle finally. which inserts in the upper lip of the crest of the spine of scapula, the acromion process, and the lateral one third of clavicle. So this was it about the muscle attachments. Okay, let's talk about the ligaments that are associated with the scapula. Firstly, we have the glenoid labrum, which attaches to the margins of the glenoid cavity and it provides support to the shoulder joint. Then we have the coracoacromion ligament, which is attached to the lateral border of the coracoid process and the medial side of the tip of the acromion process. Then we have the coracohumeral ligament, which is attached to the root of the coracoid process. Then we have the coracoclavicular ligament, which is attached on the coracoid process, the trapezoid part, and the conoid part of the clavicle bone. Then we have the suprascapular ligament, which bridges across the suprascapular notch, converting it into a foramen. And just above this ligament, we have the passage for the suprascapular vessels, and just below this ligament, in the suprascapular foramen, we have the passage for suprascapular nerve. Then we have the spinoglenoid ligament, which bridges over the spinoglenoid notch, converting it into a foramen again, obviously the spinoglenoid foramen. And just above this ligament, we have the passage for the supraclavicular nerve, and just below this ligament, in the spinoglenoid notch, we have the passage for supraclavicular artery and vein. The clinicals associated with scapula are the winging of scapula and the scaphoid scapula. So, talking about the winging of scapula first. So, if you remember, we talked about this muscle called the serratus anterior muscle. Here, the serratus anterior muscle, which has got its origin in the upper eight ribs and it inserts in the medial border and the inferior angle of the scapula. So now you see that it inserts in the scapula, and one of its functions is protraction of scapula. Wait, let me show you my notes on the topic of the pectoral region. Yeah, so here we have the serratus anterior muscle. Now, just keep in mind that it inserts in the scapula. It is innervated by the long thoracic nerve, and the root value for this nerve is C5, C6, and C7. And here you can see that one of its main actions includes protraction of scapula, which is the movement that occurs at your scapula when you are punching. So, which is also why it is known as the boxer's muscle, because when you make a clenched fist and you punch, the movement that is occurring on your scapula is basically its protection. And since this muscle is the reason behind this movement on your scapula, so if this muscle gets damaged, or to say more correctly, if the nerve that is innervating this muscle gets damaged, basically the clinical condition that occurs is called the winging of scapula. Now let's get back to the previous page. Yeah, here. So now I hope you can relate that in the condition of winging of scapula, the patient is unable to protract the scapula, and also as a result, the medial border and the inferior angle of scapula is elevated at the back, and the arm cannot be abducted more than 90 degrees. So yeah, these 2 points are very important to note, and also that the protection of scapula gets limited. And secondly, we have the scaphoid scapula, which is a developmental anomaly and in which the medial border gets concaved. So, this was all it about the scapula or the shoulder bone, and I really hope you found these notes and plus the explanation helpful. If you have any questions, you may ask them in the comment section. We will learn about the shoulder joint in the next video. Till then, stay tuned and Allah Hafiz.